Hello everyone, this is Dr. Teba and today you will learn about complete hydatidiform mole on ultrasound. A complete hydatidiform mole or a complete molar pregnancy is the most common type of gestational trophoblastic disease. In this condition, no embryo is formed and no fetal parts are seen. Instead, the uterus is filled with an abnormal benign mass. Ultrasound findings are often spotted by extremely high levels of beta HCG, and clinical features include vaginal bleeding, hyperemesis, cavitrum, which is extreme morning sickness, or symptoms of hyperthyroidism. We will compare the appearance of a normal pregnancy with complete molar pregnancy. These are transvaginal images in longitudinal plane. In the image on the left, we have a normal gestational sac with a normal embryo. The uterus is also normal. In this image, we have our complete hydatidiform mole, a complete molar pregnancy. No embryo or fetal parts are visible. Instead, we see an echogenic mass in the uterine cavity with multiple cysts. This type of appearance is termed a snowstorm appearance. The echogenic mass is filled with cystic spaces. This is snowstorm appearance. Here is another image showing a complete hydatidiform mole. We see a large mass filled with multiple cystic spaces and no fetal parts or embryonic parts are visible. This is transabdominal image in longitudinal plane showing the normal uterus with a normal gestational sac. The uterus is normal in size, whereas in this image the uterus is enlarged. In gestational trophoblastic disease, the uterus is enlarged and there is no normal gestational sac or embryo. Instead, there is an echogenic mass with multiple cystic spaces in the uterine cavity. This is an image of complete molar pregnancy at 14 weeks. No fetal parts were seen. Instead, there was an echogenic mass with multicystic spaces. The image on the left is of a normal 14 weeks pregnancy. There is another image of a complete molar pregnancy seen in the second trimester. The uterine cavity is filled with a large echogenic mass with multiple cystic spaces. Doppler features of a molar pregnancy are variable, but in usual cases, areas of increased vascularity are seen. In this image, power Doppler is applied. You can see Doppler signals within the echogenic mass. These suggest areas of increased vascularity. In this image, color Doppler is applied. You can see areas of increased vascularity within the echogenic mass. The ovaries can also be affected in a molar pregnancy. Lutein are seen is usually present with bilateral lutein cyst. The image on the left is of a normal ovary. In our transabdominal image, on the right side you can see an enlarged ovary which is filled with multiple anechoic cystic. This in echogenic area is ovarian stroma. Both the right and left ovaries will be enlarged and will have this type of appearance. There is another image showing the celluloid. The ovary is enlarged and has multiple anechoic cystic, and this area is the ovarian stroma. Thank you so much for watching. Please subscribe and stay tuned for more imaging and informative videos.